Hi, I'm Dr. Jayakrishnan, a specialist in internal medicine, Aster Clinics Fujairah. Today we will discuss about two main topics. One is blood pressure and the other is diabetes. Okay. So before I begin, let us understand what is blood pressure. Blood pressure is the pressure that is exerted by the blood column on the blood vessels after that blood gets pumped from the heart. And elevated blood pressure is what we call hypertension, and that term may be very familiar to all of us. So hypertension, we know that is very common among us, and there are many risk factors for that also. And one of the main risk factors is genetic factors, and the other risk factors include obesity, our sedentary lifestyle, increased salt intake, etc., and also increased stress in our life. Okay, so all these factors can contribute to elevated blood pressure or hypertension. Okay, so let me ask you, all of us may be familiar with the values like 120, 80 millimeters mercury is my blood pressure. Okay, so what does that 120 denote and what does that 80 denote? So let us learn that. So that 120 denotes the systolic blood pressure and that 80 denotes the diastolic blood pressure. So what is the systolic blood pressure? So before we understand what is systolic blood pressure, we have to learn what is systole. So systole is the part of the cardiac cycle during which the heart contracts, and the blood pressure during that period is known as the systolic blood pressure. And the phase of the cardiac cycle during which the heart relaxes is known as diastole, and the blood pressure during that period is called diastolic blood pressure. So we have two values for the blood pressure. One is systolic blood pressure and the other is the diastolic blood pressure. So all these values should be kept within the normal for our blood pressure to be normal. So all the risk factors, as I told before, that can contribute to elevated blood pressure or hypertension. And so why should we keep this blood pressure within the normal range? What happens if it crosses the normal range? Okay. For example, if we run for a few meters, maybe 100 meters we are running, and then when we are checking our blood pressure, normally the blood pressure will be high. Okay, so normal exercise can cause increased blood pressure, and when we take rest it comes back to the normal value. Okay, but when that does not return to the normal value, I mean for some people the blood pressure will be elevated, and that is hypertension. Okay, so what are the complications of hypertension? Okay, hypertension can cause complications in the major organs in our body. So that is the main reason why we need to treat elevated blood pressure and keep that blood pressure in the normal range. So elevated blood pressure can cause hypertensive heart disease, that is, it can affect the heart. Okay, heart. Then elevated blood pressure can affect the kidneys also, so that we call hypertensive kidney disease. Okay, sometimes you might have heard some patients had high BP and they had stroke also. Okay, so elevated blood pressure can even cause stroke, that is intracranial bleed. This can be another complication of elevated blood pressure. So it can affect the heart, it can affect the kidneys, it can affect the brain, it can even affect the eyes, that we call hypertensive retinopathy. So in order to prevent all these complications which can arise from hypertension, we need to treat the hypertension and keep the blood pressure in the normal range.